Today in Health View, from Botox to butt implants, fillers to tummy tucks, there are countless cosmetic procedures. Allure magazine sorted through them all and came up with its list of most overrated. And joining us this morning to talk about them is cosmetic plastic surgeon Dr. Jennifer Walden. Dr. Walden, thanks for joining us.
Thank you very much.
All right, so the list goes on and on, but at the top of the list is the vampire facelift, where surgeons use a patient's own blood. Explain that.
Right, so this is a highly marketed procedure where a patient's own blood is taken, spun down, and the red blood cells are removed, and the thin yellow plasma layer is injected into the face. There are no scientific studies proving that this actually can lift the face or improve the skin. It was actually borrowed from orthopedic surgery to promote healing, but there's no tried and true scientific evidence showing this. Some surgeons actually plump the face with fillers, like Restylane or Juvederm, and inject the plasma, but it's really the fillers that are causing the plumping, not the plasma. So don't waste your money on this one.
Okay, and that's what we're wanting to know is, are these procedures worth your money? So the next one, does laser liposuction live up to its claims? Laser liposuction, is that like smart lipo, what people call?
Right. Smart lipo is one term for it. It involves putting a laser wand into the fat under the surface of the skin, which melts the fat, and then standard liposuction techniques are used to suction the fat out. And that really has shown no benefit over the tried and true method of standard liposuction, and actually can cause burns or thermal injury, tissue hardening, prolonged pain, and also can just add on time and money to the procedure itself.
So what are the pros of it? Because I know some people are talking about the anesthesia. Is it local sometimes?
Yeah, yes, but traditional liposuction can also be done under local anesthesia.
Okay.
And as well, it was said and touted to promote skin retraction, but we found that standard liposuction methods and power-assisted liposuction methods can also stimulate the same type of skin retraction or contraction process.
Describe the stem cell facelift for us.
So stem cells are, the great hope of modern medicine. They're those progenitor blank slate cells that can go on to different types of tissue cells. They're found in adult fat. When we inject fat into the face, many doctors have been claiming that stem cells are promoting skin rejuvenation and the erasing of wrinkles. We can't really say that without a lot of multi-centered scientific clinical trials, and we just don't have that data yet to say that stem cells are actually doing that. We don't know how critical they are in that process of cosmetic improvement of our face.
Well, number 4 here was foot lifts, and I'm not really sure what that's about.
Right. So foot lifts is basically when surgeons or doctors are liposuctioning the small toe, shortening the long toe, things to help squeeze into tight shoes like Jimmy Choos. You know how narrow those shoes can be. But really, the foot is heavily relied upon for function. So most foot doctors and orthopedic surgeons do not advise upon altering the architecture of the foot, because we need that for proper walking and running. We shouldn't do it just to make the foot look pretty.
I guess if you can afford a Jimmy Choo shoe, then maybe you can afford this foot lift. But how much do they run?
Well, usually procedures like these are running between like $1,000 and $4,000.
Ah, okay. And how about fat injections for breasts? So basically, I mean, it's what it says it is. They just inject fat so that they look plumper? Is that basically?
Right. And fat injection to the breast has been popular in the past 4 or 5 years. Basically, we know it's good for contouring the reconstructed breast or helping with implant-related rippling or wrinkling problems. But a recent study by NYU showed that for fat injections to a reconstructed breast, within about 4 or 5 months, 50% of the fat that was injected resorbed. So those are just not long-term results that we can say is the standard of care yet. More concerning is that some problems on mammogram can occur, such as fat necrosis and calcifications, or the stem cells within the injected fat might years later stimulate breast cancer. And until we have the data to prove that fat injections to the breast are safe, we should not say that that is the standard of care yet for breast augmentation.
All right, so your best advice if you're thinking about getting one of these procedures, just do your research and consult with a doctor.
Right, a board-certified plastic surgeon, certified by the American Board of Plastic Surgery.
Dr. Walden, thank you for coming in.
Thank you so much.
Sorting it all out. Okay, Brian, over to you.
All right, thanks a lot.